So I'd like to introduce our first speaker, keynote speaker, Dr. Alaa Youssef, PhD. She's the Chief AI Officer at WiDS AI, where she leads enterprise-wide AI strategy, innovation, and governance across healthcare and life science domain. With a PhD in data science and population health, her work bridges advanced AI development with ethical, safe, and equitable deployment in high-stakes, real-world environments. An AI medical education scholar and curriculum innovator, Dr. Youssef received a competitive Raise Health Grant Award to build competency-based AI training across Stanford School of Medicine. We need her here. She brings expertise in responsible AI integration, human AI interaction, and designing competency-based training programs that bridge clinical practice and AI technology. She's authored over 25 peer-reviewed publications and regularly advises public, private, and nonprofit organizations on AI strategy. Dr. Youssef has shaped foundational AI education at institutions like Stanford Healthcare and co-founded the Amy High School Education Program to foster inclusive AI talent pipeline. As a recognized thought leader, Dr. Youssef now focuses on accelerating organizational AI transformation, guiding cross-functional teams through scalable, mission-driven AI adoption that delivers measurable business value while maintaining ethical integrity. Please join me in welcoming Dr. Youssef.
Perfect. So first of all, thank you so much, Dr. Gada. This is really a very warm intro and a lot for me. And I want to say that I really wished I could be with you all in person. And I dreamed about this since the summer, since Dr. Fatma and Dr. Gada approached me with the invitation. And I was very excited about that, but I hopefully will join you next year. Today I want to give you a quick glimpse between, I always struggled between how AI accelerate as a research versus how it accelerate in clinic. And in my work at Stanford, I have worked with clinicians in workflow. And so I'm hoping to bring to you today something that is practical. And I really have passion for how can we really bring talent and how can we leverage AI to really help strengthen our health systems in the Middle East. So let me go ahead and share my screen, and please let me know if you are able to see my slides. Good?
Yes, we are.
Awesome.
Go ahead.
Okay. So I'm a PhD scientist. I always had passion to land in medicine, and I always struggled with balancing research and clinical. But I have been deeply embedded in clinical, and so my whole focus since my PhD was how do you design effective health systems? And in North America, there's a big component around value-based care and how can you achieve that. And I was really always centered around health system design. So I feel today's talk is really close to my heart. So here is what I would want you to leave today from this talk with. These are call to action. So if you're leaving from today, I want you to learn these few lessons. One is innovation can start from bottom up. It doesn't have to come from top down. So you as clinicians, you as faculty can bring all that innovation of what ideas and problems to solve. You can leverage AI to turn your pain points into value, and this is the strategic way of how you should be thinking about AI. You need to take a commitment to responsible AI, where responsible AI is not a choice, but it is a moral obligation as well as a vision as part of an organizational mission. And governance can be seen as a roadblock, and it can be a roadblock, but it's also an enabler for how we deploy things to build trust with clinicians, with patients, and with providers. And next is, and perhaps close and dear to what Dr. Ghada was saying, is you need to invest in your pipeline for talent. So the next generation of physicians, and today's also physicians. So here is the agenda for today. I'm just going to start with how do you understand where your health system stands as AI readiness, and then if you're trying to think of in your context of where is health system, we all know like Middle Eastern countries and developing countries and many of our countries struggle with resources and infrastructures. We're not as North America, for example. And so in those components, but I want to tell you that North America themselves struggle. Like I can tell you this very clearly. So in this case, how do you identify what is a good use case to invest in? And then here's the universal challenges. We have not figured it all. We still have a lot of things to figure out, and it's global. So we're all on this together. And then AI training is key to for safe, innovative, and effective AI. So here, I want to start by this is from Gartner, which is a very popular business report, and it talks a lot about strategy, organizations, AI adoptions, and scale. And as Dr. Ghada was mentioning, in industry there has been a lot of money being dumped in into AI, but still people are not sure what is the AI real value, how to drive ROI. And there is a very one big theme that actually came from a conference last week at Stanford, which is technology is 2% and workflow is 98%. So what is going to drive innovation is not the model. It is the work process you're going to put around it, and it's the work process you're going to understand. And therefore, you need to define what is your AI strategy. Where do you think you want to be leveraging AI? What is a high use case value for you to think about in terms of AI? And you have limited resources. Where would you invest? Would you invest in imaging department? Would you invest in ICU, for example, or neonatal care? How do you bet your choices? And then what is your business model? And how do you think about your workforce readiness on the long term? And there is a one very important component in a lesson that we're all learning, which is no technology today implemented is here to stay forever. So you need to build in the mental muscle that we are going to implement something, and if it does not work, we are revamped. You see this not only in healthcare, but in big tech. Big tech, like all of the big tech companies from all of the ones you can think about in technology, they spin off organizations to be focusing on AI value. And if they don't achieve that value, they dismantle that and they restart something else. And so you always need to be thinking in mind, nothing means because I invested in it, it's a long life commitment. It's not marriage. Well, here's understanding your AI maturity. So there is different models on how you would understand your AI maturity. This is one that is common. It was published in New England Medical Journal, and it was talking about there is different domains on how you would assess that. There is culture, governance, business, value, information architecture. I find that this framework, which is part of publication and a team I have been working with, is really very helpful. It's called the 5S framework, and the 5S framework stands for Paul Farmer, who was a very famous sociologist in the U.S. And his idea was you cannot be thinking about implementation of technology without thinking of the hierarchies of the social processes within the society that is enforcing that. And that means we cannot be thinking about AI without thinking of who are the people using the AI. Before you start of thinking of AI, you need to understand and listen to your providers and clinicians on what is a good use case. You need to understand what are the tools that you're going to need. You need to understand what is the system and how are the spaces. So here is another way of thinking about this. Every time you think of AI, you need to think of the healthcare workforce, how they're going to be trained, how is this going to be integrated in their payment model, if this is at all a concern. And then you need to be thinking about stuff. What are essential algorithms? What are essential tools? What are being concerned as luxury? What is the spaces? Are we talking about physical spaces, or are we talking about telemedicine, for example? And that still count as space. Systems, do you have the infrastructure? What is your EHR integration, electronic health record? And at the end of the day, like here's one thing we talk about very well, because unfortunately North America is like there's a lot of disparities in how healthcare is being delivered. based on social determinants of health. So again, I was saying, like, we haven't figured it all. Yes, you can find at Stanford the top most innovative implementations, but at another community health, you will really find something that is even that's not present, like it's much lower than what we have in the Middle East. So I want you to think between, there was always the hype of between the AI potential and the vision of like AI is going to transform agents, LLM, ChatGPT, and what this can be now. So I like to be practical and I like to think of what is now. What can I use and think about in terms of now? And if you put back the framework I talked to you about, here's what you would want to think about, and here's some example use cases. Let's take, for example, the use cases, and I'm going to delve into those examples shortly in more depth. But if you can think about it, there's the ambient scribe. So in the US, there's a very big challenge with physician burnout due to the required level of documentation. Clinicians need to spend for every patient, they need to spend around, like 30 to 40 minutes documenting the care visit for that patient, and that is essential for them to be paid. And this leads to enormous burnout in 90 on over 90% of physicians. And so AI scribes, when they came in and they got in, these do not require, for example, to be embedded in, like, these are stuff these would consider as stuff, but they mainly require the staff to endorse and adopt them. They start with providers as the main adopters. They need to be integrated within the system, and they are able to be a quick spin off compared, for example, to implementing an algorithm in my radiology workflow or in my ICU. Open evidence, I don't know, I can see in the room, show hands, but how many of you have heard of open evidence or is using open evidence? I wish I can see this in the room. Maybe there's no. Can someone tell me show of hands? Okay, it's hard to get
It's
that sense,
nil,
but
not much.
so
One person.
okay, okay,
One
okay,
person.
okay.
Two persons,
So
sorry.
okay, so here's open evidence, something to go check out after this talk. Open evidence is like your chat GPT, but for physicians. So rather than you having to search the literature and go and search in New England Medical Journal and Nature Medicine, every clinician nowadays have, like their screen where they see the HR record, and they have another screen where open evidence is there, and they would type in, I have this case X, and then it will pull in the peer-reviewed evidence, and so it's gonna pull to you the most recent and evident. How is this different is than ChatGPT? We know that GPTs and LLMs hallucinate, and so open evidence is something that had a valuation over $2 billion, and it's spin off this way, and it's just like really easy to adopt. So if you think about it, does not need a lot of infrastructure, but you need to think about how can it help me, whether I'm working with rare cases, whether I'm working in workflow and it would be helpful for me to review evidence. What would that tool help me in my workflow? Maybe it's not that of a high value yield for you, and that's fine. But it's important to think of what this use case is and how it's going to bring that value in. Sepsis detection and AI imaging are examples of things that would require investment in staff, spaces. You need to integrate this within the spaces, ICUs, imaging departments. You need to think about integration in system packs, a lot of things to be considered when implementing those. So those would be on the high end. So one thing to kind of like learn about is that AI implementation in over, like, I think I started my postdoc at Stanford around 2021, and ChatGPT came around 2023. And on 2023, 2024, there is a spin-off in how healthcare systems started to be, whether as physicians or as leaders in health systems, thinking of AI. Initially, we need AI to be pilot, we need randomized control trial, we need, once ChatGPT has came in, something has changed. There was a big disruption, and that was not only in healthcare, but this was everywhere. So what you see on this graph is like also from Gartner, which kind of published a lot of things about the hype of technology and its implementation stakes. So you would look at, what is the stages of the different types of AI development, and here it shows you on the time for them to plateau. And everyone agrees we are now in a bubble. this bubble is going to burst. So if you know something about Silicon Valley, there's a lot of investment in startups right now. There's a lot of dumping of money, but there is that kind of belief that this bubble is about to burst, and then it's going to flatten around cases and startups and industry that is really built around solid use cases, because a lot of things are, LLMs are easy to spin off. A lot of it is ideas, but again, technology is 2%, workflows 98%. So if you can figure out what is a good workflow, you actually have a very good business use case. So here is like more on to focus on problem, scope, and impact. How defines the AI use case selection. So this is some of what I have covered, but this is also again like some of the what we have seen also here in North America. So sepsis, other models, imaging models, all of those were good models, but something was different. Once AI scribes have came in, they did pilot studies in Stanford and all big centers, and was the only one use case where this was 100% adoption from physician, at least in the beginning, and then it lowered on to 80%. And then while the technology is not perfect, people still wanted to adopt the technology. And why would they want to do that? Well, it was because it was helping them cut the time and to spend on documenting medical chart, drafting notes. In Stanford Healthcare, for example, a physician received a lot of patient requests on, can I renew this medication? Or I have this question, it might not be urgent. And so they integrated that to patient response message. Physicians still have to approve that, but it's get you started with a draft. The AI scribes is you dictate, and for the first time, the feedback was coming to hospital leaders is patients are actually happy because the physician is now looking at the patient. And the physician is feeling they have time to what they care about as patient care rather than just administrative and documentation work. And so in this kind of like spider web diagram, you see the dimensions on which the AI scribes were evaluated. And if you know of Kaiser Permanente, it's one of the biggest health models in the US. It has over 40 locations, and it actually tested in over 21 locations, so more than half its deployment. And based on that, it was like the quickest. And why was that adoption the quickest? Because there was a pain point. Pain point was burnout. And so the takeaway is, if you can find what is a pain point in your workflow, you can bring this up into your health system, and that can drive the strategy and the vision of what is a good use case to get started on today. And so embracing a bottom-up approach and starting with use cases that address your pain points can be a good way to get started compared to having, being overwhelmed with how I'm going to get started on all this AI hype. And we are seeing that now all health systems are investing in AI. You can see in here that, at the top percent of industries, healthcares are being spent and money are being spent in here because it's actually saving dollars on an operational level. So you might adopt AI, not necessarily at a diagnostic level yet, but you might implement it to improve your workflow. You can see this in imaging and triaging. I'm sure Dr. Arnaud will have more to talk about this. And you can see also that healthcare spending is actually money is flowing towards AI scribes, coding and billing. So these are tedious administrative things, but you get the point. So other applications of LLMs in medicine where generative AI has also kind of made space is like in tumor boards and discussions. So, okay, so how is it doing this in tumor boards practically? Well, there's things that are clinician facing and there's things that are patient facing. So for example, we have seen a lot of agents or chatbots that are more empathetic. They're able, even research from Nature and New England Medical Journal is showing that actually patients like interacting. Now, this is not replacing interactions with physicians, but as a quick start, if the patients have questions, these are tools that are becoming part of embedded. And what is really AI is helping us transform is helping transform the medical industry of drug discovery. Because similar to ChatGPT, there's models that are focused like AlphaFold and others, and these are biological models that help us identify drug targets. And that is helping cut the time to drug discovery by 80%. There's no kind of like big medications that have been kind of like came out of that, and we kind of know like AI is saving in terms of like still drugs, but it is really accelerating the process of drug discovery and the time and money pharmaceutical companies spend on that. Not that they need to make more money, but just yeah. And then on the other component in workflow is clinicians are using that. For example, at Stanford, they did a trial where can we use these models to help aggregate cases and pull evidence and present that as a comprehensive report for tumor board cases where there needs to be everyone needs to be on board on this case before they can reach to a consensus. And so some of those cases are being used. So you can think of how these tools can be, if they are properly vetted and secure, how they can help you in your own workflow. So quickly, let's talk about the universal challenges that are related to AI implementation. So, despite whether AI, generative AI, or traditional AI, which is your machine learning, supervised, unsupervised learning, clinicians would love AI to be transparent. Why? Because as a clinicians want to be able to explain to patients with confidence why I'm coming at this diagnosis. And unfortunately, we know AI is a black box, that it's not easily for you to be able to always be able to attribute the reason of why the AI is making that clinical diagnosis or that recommendation. I'll give you one quick example, which is in medical imaging, deep learning models, which is vision models, they're able to recognize things on medical imaging. They have been transformative in terms of like their ability to identify a lot of diagnostic imaging diagnosis to a high accuracy, actually. But one very interesting component was the fact that we now, as we start to study how these models are predicting, we now get to understand that, for example, a model might be identifying that these patients have pneumothorax. It's not because of features specifically in the image, but it's because typically patients with pneumothorax who have been exposed or trained, or their images have been used to train models, they're typically intubated, they're typically in the hospitals, and there's usually tubes or other types of devices that makes the model identify, and we call this spurious correlation, where it's not the true reason of why the model is arriving at this right diagnosis. And so this is where it's important for us to understand what's interpretable or not, and transparency. And of course, you still need to build your infrastructure for data sets. I cannot stress this enough. The gold mine is data, and even for these big models, building good data is so important. And I understand how challenging and how much work needs to go into building that. But I think this is like a strategic investment in your healthcare to build your infrastructure for proper data collection. Bias, we know that bias here is a big issue, and there's a lot of ethical risks, specifically around if you're using AI that's coming from outside, where you don't have an insight into how the data is being used. And this is why it's important to be educated well about governance. And if you're purchasing or using any open source tool, is understanding what are the risks you're posing to using clinical patient data. And so these are the ethical challenges, is we don't know how to balance the uncertainty of AI and trust it at the same time when it can be reliable to a great extent at some point. We don't understand how to have the most effective governance model, and there's always a shift between data privacy and sorry, its attention, and there's always risks of bias based on, if the model is trained in the US, it's likely to have a much better performance on a US, for example, related population than if it's deployed outside. So I know we are close to time, so I just want to quickly wrap up. But I want to say that if you're thinking of governance, it's important to think of governance, and it's I think in this publication I have put the link in, and I'm happy to make the slides available with also including the references. But in this type of work at Stanford, we did develop a framework, and it includes independencies. You will find workflow models and sheets on how we as a clinical team, where we're evaluating. We had a big team composed of finance, we had a team composed of clinicians on the workflow side, and it shows you a systematic approach into how we always define the use case and how we came around the decision, whether this is something we are going to adopt into our workflow or not. And when it comes to governance, what are the type of guardrails we're going to set around those important ethical principles to ensure we're protecting patients? So lastly is AI training. So this is, I was very fortunate, whenever you try to get health grants and you don't get a lot of health grants or, like research funding, but this is one was that I was most proud with because I always had the tension between being a clinician and doing something for medicine. And I felt like it was an imperative for me to do this around education. And I really wanted to translate the knowledge I know about what I have seen from workflow challenges and bias and challenges for clinicians to have confidence in using AI to how can we prepare clinicians to use AI safely and effectively. And so the vision for me for building impact with a great team of faculty who are world leaders in AI, including Johnson Chen, Dr. Kurt Langlotz, and a big other team, is how do we bridge the gap between the huge innovation that is always going to happen? And this applies to not only Stanford, but anywhere. And also one big component is how we make this accessible worldwide. And so you can think technology is always racing, but how do we as a clinical practice keep up with that level of innovation? If you're able to scan this QR code, and again, I can happy to share that if that is needed, the link, which is we're going to take you to an open source form, which is called the curriculum outline. It actually takes you to courses in Coursera, where we have built a curated learning catalog of the type of content that you can get started on to learn more about AI at the basic fundamental level. We're also building competency-based assessment because it's important to be able to ground yourself not in the theoretical components of what is an AOC or what is a positive predictive value in general, but what does this mean in your clinical context? And lastly, this needs AI education is not only for undergraduate medical education, but you need to be thinking across how do I prepare my people today and the people that are coming tomorrow. And so, in wrapping up, I would like to remind you of the things to take away. Is you can start with bottom up. If you're a physician, you can define the core value where your institution should go. Leverage AI to turn pain points into value, such as scribes and note taking. Commit to responsible AI and building governance, and prepare your workforce for an AI ready. And these are my references, and thank you so much for your attention. Please feel free to scan this and just message me if you have any questions or would like to connect on LinkedIn or on my email. Thank you so much.
Thank you so much, Dr. Youssef. This was an amazing talk. You went through a lot. Just for the sake of keeping time, we're going to not take questions, but I will channel all questions to you through the OBS staff. Our next speaker, thank you so much.